Hello, everybody. I welcome you to this session. The main topic of this first part is homeopathic pathogenetic trials and global strategy. Um, Welcome, Dr. Sristi. And I want to invite Dr. Prita with the first presentation.
Good evening, everyone. First of all, I would like to thank the organizers for giving me this opportunity. I would also like to thank Dr. Anil Khurana, Director General CCRH, and Dr. Praveen Oberoi, Deputy Director General CCRH, for permitting me to present this poster in this conference. I'm sharing my screen now.
Yes, please.
Is it visible?
Yes. Please start.
Among the diverse flora of Indian subcontinent, the most widely used medicinal
Hello?
plant.
Hello? Pritha, I'm not able to hear you.
Is it okay? I'm audible?
Just a second.
Yes, ma'am, you're audible. Please continue.
Okay. So, Withenia somnifera, it is one of the very popular medicinal plant, which is known as ashwagandha, and is used in Ayurveda and other Indian system of medicine. It was first introduced in M. Bhattacharya Homeopathic Pharmacopoeia, which was published in 1927. But on searching, we couldn't find any detailed proving of this drug. So the council took up this trial to elicit the pathogenetic response of Withania somnifera in different homeopathic potencies on healthy human volunteers. This is a prospective multicenter parallel arm randomized placebo-controlled trial, which was taken up at 4 drug proving centers between 2010 to 2013. And the process which was followed, the volunteers were screened, their health status was checked. 67 volunteers were screened, and out of which 4 were excluded because of various pathological findings. 63 were enrolled and randomized into 2 groups. In Verum, 43 were enrolled, and then in control group, the 20 provers were enrolled. And then the intervention with respect to both the groups was administered in 3 phases. In the first phase, placebo was administered to all the provers. In the second phase, 6C of in the Verum group, 6C of Withania somnifera in the Verum, and placebo in the control. And in the third phase, 30C of Withania somnifera was administered in the Verum group, and placebo continued in the control group. So during all these phases, the provers were noting down their symptoms or any change in their physical or mental aspect or any other signs if they have found. And the proving masters or the site investigators, they elaborated those symptoms. The data was received at the proving data processing cell of the council, where all the proving symptoms were compiled, and then the analysis was done to get the results. Coming to the results, both the groups were found comparable before and after the trial. The pathogenetic response which we received in the Verum group, out of 43 provers, 16, that is 37.2% of the provers, they developed the symptoms, and in the placebo group, only 4 provers, that is 20% of them, developed certain symptoms. Coming to the number of symptoms, in the Verum group, 39 symptoms developed. In the placebo group, only 12 symptoms were found. And if we looked at all the symptoms which developed, the duration of the symptom, the minimum duration was of 15 minutes and maximum for one of the symptom was 9 days. On repertorizing all the symptoms and the objective findings which were compiled in this trial, phosphorus covered maximum rubrics, and so we can consider phosphorus as the chemical analog for this drug. Organ affinity, if we look at, This drug has has shown affinity towards almost all the organ system of our body, starting from the head, eyes, nose, then throat, respiratory tract, GI tract, skin, and the joints. And again, the qualitative analysis which was done for the subjective findings, we could see that the traditional uses, the pharmacological action was corroborating with the findings of this trial. This drug is mostly used as an anti-inflammatory agent, for infectious diseases, for bronchitis, for dyspepsia, liver. It is used as a liver tonic. It is used for bone and joint affections, for certain bacterial infections, and in the diabetes in animal model. So they have in our trial also what we found that there was inflammatory changes like glossitis, conjunctivitis, rhinitis, and gastritis, enteritis, similar symptoms. Like I'm using the terminologies to emphasize on the inflammatory reaction of this drug, which was produced. Then in infectious diseases also, if we look at even the enteritis, the loose motions and all, which has developed, and the griping pain. So it is corroborating, all these findings were corroborating with the bronchitis and all conditions. And fever also developed. In diabetes, in the animal model, we found that there was a change, there was an increase in the fasting blood sugar level. And similarly, among the objective findings, if we see, it is used as an immune stimulant where the white blood cell count is low, this drug is given. And in our trial, we found that there was an increase in the TLC. It is effective in weight gain, and the BMI has also been found to have increased in the verum group who have produced symptoms. There were some other interesting findings, which I have reflected it here, that before the trial, there were two provers who had shown left renal calculi and renal concretions, but after the trial, the ultrasound has shown no abnormality. But in the urine, there was calcium oxalate crystals found in the second prover at serial number 2. And also, if you see at serial number 5, also calcium oxalate crystals were found after the trial. However, if you look at the ovarian cysts were there in the before the trial initiated in two of the provers, but subsequently there was nothing abnormality detected. And if you look at serial number 6, the ultrasound post trial, left ovarian cyst was found. Similarly, for stool examination, the E. vermicularis ova was found in the before the trial, but subsequently it was not there. And in the prover at serial number 6, the E. histolytica cyst, and on in the urine examination, amorphous phosphate crystals were found. So what we have deciphered out of it is that this drug has a pathogenetic effect as well as curative effect on these aspects as well. Coming to the adverse drug reaction or adverse event and adverse drug reaction, we have found there are hematological and biochemistry changes, but they were within the normal range. And only two provers had to be antidoted for the severity of symptom with respect to headache and fever, but they recovered without any residual effect. So we cannot say that it is the adverse drug reaction because they recovered. And moreover, these were only two individuals at two different centers who have told about such events. And to conclude, see, many manifestations have corroborated with the traditional uses. Thus, it has uh, uh, increased the scope of use of this drug in homeopathic potencies, and it has also confirmed that the symptoms which generate in the trial are transient. Drug proving does not lead to pathological changes. And further, few new pathological or pathogenesis which has developed needs validation through clinical verification studies. Thank you so much.
The chairs, do they have any questions for the pen for the speaker? Dr. Sangeeta?
No, I don't have a question. In fact, I would like to compliment her on her, nice presentation. And she had explained things very well. And in fact, the simile given by her to phosphorus is also good. Dr. Pritha, you have written that it has been done in 4 places.
Yes, ma'am.
Right? This trial was done.
Yes, ma'am.
Okay. And The duration is?
Ma'am, the duration is from 2010 to 2013.
3 years, you mean to say, or 4 years?
Ma'am, actually, 3 years. For two centers, we had given for 2 years, for 1 year. And then in between, there was a lapse of time. And then for another two centers, it was again given. So there was a little in between, there was a gap. So that's why it is like 3 years. And the compilation and all these took place subsequently.
Okay. But this certainly needs validation through clinical verification.
Definitely, ma'am, because it's a new drug and because no proving has been done. It is broadly used in Ayurveda and Unani medicine mostly. And if
Yeah,
we are
that's
going to
right.
use this in homeopathy, definitely because of the corroborating symptoms, I feel that these symptoms should be taken up in the Mitra Medica and should be used by the
Yeah.
physicians. But there are certain new symptoms. Actually, this paper has already been published in Indian Journal of Research in Homeopathy. So maybe like validation is definitely required. The clinical validation is required for this.
Dr. Ashley has a question for you, Dr. Pritha.
Sir.
Sir, please unmute yourself, sir.
Sorry, Dr. Mehra, thank you for that presentation. I have actually two questions. The one relates to how you verified Verum symptoms. It's normal in a proving methodology to compare the individual in the proving to their baseline data. But to what extent did you eliminate a symptom from the Verum group if it was produced in a placebo prover?
Yes, sir. That's what the phase 1 trial, that was where the placebo was administered in both the groups. So basically, we have inter-prover and intra-prover data analysis done. And wherever there was an overlapping of the symptoms. So actually, we are doing this with the students of the homeopathic medical colleges. And Michael Chewett's one of the article which I read, he has talked about the nocebo effect. So
Yes.
I consider that overlapping of the symptoms can happen among these students because at times, like you converse with each other and you say that, like, yeah, after taking this drug, I got some dizziness or some headache or something like that. And the other one says, yeah, even I experienced, but I didn't mention it in my logbook. And then they mention it. So that's what I am saying, that even we cannot rule out those symptoms. This can be a nocebo effect. So if these are the new findings or the new symptoms, this needs to be clinically validated, or clinical verification should be done for such symptoms.
Okay, and another comment. You may not be aware of it, but Withania somnifera has been proven twice previously.
So thank you so much. Actually, I got this comment and I've gone through that dissertation which was submitted by Dr. Marissa. Sir, she has done this in 2014, and we initiated our trial in 2010. But the publication happened little later than when she had brought it out in 2015. 31st of May, this was available on. I have gone through that. So thank you so much for enlightening me on that, sir.
Okay, because I think going forward, if you're to publish around this particular proving, you would have to relate what you found in this proving to what might have come up in 2014 with Laidlaw. And then the one other question that I had, where I saw you've compared it to phosphorus. Did you attempt in any way to relate the proving of Withania to any other remedies in the Solanaceae family?
Sir, I have not related phosphorus like that. What I have said is that all the symptoms which were generated, we repertorized them. We converted them into certain rubrics. Yeah, so the phosphorus was covering most of those symptoms, those rubrics. So that's why I'm just saying that it could be a chemical analog for this drug. So a relationship can be established. So maybe we can take up this as a study as well.
Yeah, it would be interesting to compare it to other Solanaceae.
Definitely.
Just in terms of the sort of group analysis concept, to be able to
Right.
distinguish it,
Right.
for instance, from belladonna, which I know in Laidlaw is proving there was some overlap of symptoms, belladonna, dulcamara, tabacum, etc. So we may want to be able to differentiate it from such remedies. Okay, thank you.
Thank you, sir. Thank you so much.
Dr. Fraz, do you have any questions for ma'am?
I have to excuse, I just arrived a little bit later because it is snowing in Vienna and everything, the traffic was a little bit difficult. So I've just arrived here.
Welcome to the session, sir.
So please excuse, but now I'm here.
Thank you.
Okay, thank you, Dr. Prita, for your excellent presentation and all the panelists for the questions. We continue with our next presenter, that is Dr. Prita, and the title of the abstract is Homeopathic Drug Proving Researchers, a Scoping Review. Welcome, Dr. Prita.
I'm really sorry. I couldn't submit the poster for this, and I will not be going ahead with this. I'm really sorry for that.
Okay, thank you. Thank you. So we continue with Professor Monica Bayer from Brazil, who is going to present an abstract related to molybdenum metallicum. Well, the title is in Portuguese. So welcome, Dr. Monica Bayer. Please continue with your presentation.
Adriana, is she connected?
She was connected, but I don't see her right now. I don't know if maybe she's having connection problems. So maybe we should continue with the next presenter and then we come back to her. What do you think?
Yeah, I think we should carry on with the next one.
Yeah, perfect. So we continue with Professor Setil Kumar, who is going to present a poster related, is it a isopathic remedy or indicated similia, role of an indicated nosode as an acute shot in a pandemic. Welcome, Doctor.
Hello.
Welcome, Doctor. We see your screen.
Okay. I am Dr. Setil Kumar. I am a professor working in Vinaya Mission Research Foundation University.
Sorry, Doctor. I think there is an echo. And so I don't know if for...
Now it is okay, madam.
Now it's perfect. Thank you.
I am working as a professor in Vinaya Mission Research Foundation, deemed University, India. So my title is it an isopathic remedy or indicated similia, role of an indicated nosode as an acute shot in pandemic? So finding the efficacy of an indicated nosode in a life-threatening pandemic. The COVID-19 pandemic imposed a special challenge to all the therapists, high mortality and severe morbidity with too little time to act. Therefore, one needs to be too quick to act, sure about the prescription and produce result. So nosodes are broadly defined as a potentized homeopathic remedies prepared from deceased tissue, organ, secretions, excretions, microorganisms, and cultures, and widely used as a first prescription, second prescription, case closing prescription on various indications. One such a remedy is used as a first prescription in an acute life-threatening pandemic, and its efficacy is assessed. So the methodology is followed is actually the case registration from the September 1st, 2020 to September 15, 2020. Follow last date October 15, 2020. Totally it was 30 days. Study geographical location is Salem, India. The sample size is 32. The inclusion criteria, any 3 clinical symptoms from among coryza, fever, loss of taste, loss of smell, backache, headache, malaise for 3 days or more than that. Unilateral or bilateral otitis media diagnosed confirmed by otorhinolaryngologist and RT-PCR positive cases, and SpO2 it should be less than 90 or more than 90. Age group between the 18 to 70. Almost we have taken the middle age group, that is 46. So case taking, reference and dosing. Case taking format, homeopathic acute case taking including probable physical emotional cause, complaints, duration, location, sensation, modality, and concomitant. Acute physical generals and energy level also considered. Indicated for the remedy selection, ears, inflammation, otitis media, influenza. A reference, a repertory of homeopathic nosors and sarcos by Berkeley Square. Dosing, influenza 1000 CH, 5 pills, dispensed in a 100 ml aqua in 8 drops. Dosing, patient is asked to shake the bottle well, consume 6 ml of medicinal solution once at 8 a.m., 12 noon, 4 p.m. and 8 p.m. either before or after eating. However, to maintain the gap of 30 minutes before and after medicine. Patient to exhaust the medicine and review. Diet and regimen, as is prevailing for individual patients, the subjects are advised not to use any other substance with no medicinal property. Follow criteria. Actually, it was the consultation once in a 7 days. Early review, if existing symptoms intensified or any new symptoms are appeared, immediately the patient come back and they will give the follow. Then repeat the RT-PCR 14th and 28th day. The repeated otorhinolaryngologist evaluation 7th and 21st day. The result, the patient became asymptomatic clinically. The commencement of result 1 hour to 48 hours. Usually most of the patients are recovered within 12 hours. The complete cessation of the symptom 24 hours to 4 days, almost 72 hours. The 6 patients required another remedy 2 days to 4 days. That is mostly 60% of the patient needs the second remedy apart from the influenza. The result was observed. The RT-PCR became a negative in all patients when test was done at the first review, that is the 14th day. Resumed family and social work life early. Almost within 6 days they will come to the normal life. So SpO2 more than 96 in all subjects within a 7 days. The disease progress nil and casualty also nil. So it was concluded nosode as a first prescription in an acute life-threatening pandemic is efficacious. The indicated similar nosodes act promptly and save the life of the patient. The reason for the higher percentage of the result, I believe, is in a cases selection at the outset. So it can be concluded those cases that are not fulfilling the inclusion criteria are strictly eliminated and not included for study. That explain the need to conduct a homeopathic researches on basis of the homeopathic principles and the result as assured. Thank you, madam.
Any
Hello?
questions from the chairs?
One
Dr.
question.
Ashley.
One question.
Yes, sir.
Professor Senthil,
Yes, ma'am.
did you get the IL-6 also done? Like, what were the cases, severity of the cases which you have taken, They were mildly infected, moderately. What was their IL-6 value or CT value?
Mostly we have taken RT-PCR, madam.
RT-PCR, in RT-PCR, we have, one CT value, which
Mm,
shows the severity.
Yes, yes, madam.
And you didn't get the IL-6 test done in these cases?
No, no, madam.
Because if it is increasing, it means the disease is also increasing.
So it was the clinically observed, madam. Actually,
It was
cases
clinically observed.
Yes.
Okay. So it means you had taken only mild cases.
Almost more than 90. SbO2 is more than 90. That case is only taken.
Okay. And like in your result, you have written, actually your complete poster is not visible. Can you show us that?
Yes, ma'am. No.
Yeah, show us the complete.
Yes.
And under your, I think,
Now visible, madam.
yeah, not under results, you have written miasmatic block was also removed. How did you, came to conclusion that miasmatic block was cleared?
Because it was a it is acute case, no, madam. No source are given. That's why it was written like.
May I ask you a question? Besides influenzinum, did you use tuberculinum aviae?
No, only influenza I used, sir. Only influenza is used in all the cases. I have treated almost 250 patients, sir. In among that, these 32 I used influenza, sir. That has got good result during this pandemic.
If I can ask a question or two, which follows on from Dr. Frass's question in respect to tuberculinum aviae versus influenzinum, quite aside from the questions which colleagues have already raised in terms of how severe was the condition and how did you measure improvement, what I'm finding interesting is why did you decide to use influenzinum? What is the relationship between the influenza virus and the coronavirus? Because it's not necessarily the nosode, because there are two different virus families. There's certain symptomatic overlap. So that's my first question: is why influenzinum being argued as the nosode for a coronavirus infection? And then I also had the question about the miasmatic block, which I didn't quite understand. But how do you get to a point where you can ascribe the patient's improvement to the effect of the intervention, i.e., 84% of the patients improved, and we're not sure how we measure that improvement, but 84% improved. How do we know they would not have improved without the intervention?
Sir, actually, what I did was I was started using some common drugs for COVID-19 cases. Some cases are not responded for the common medicines. So I used to work out the cases in the Berkeley Square no source repertory, sir. I got most of the cases, this influenzinum as coming as a remedy. So I started giving the influenzinum for most of the patients. They responded well. That is the reason I have given influenzinum.
But do acute cases not respond regardless of a remedy? Would acute cases not spontaneously recover? So on what basis do you say that either we've accelerated the effect or we've produced effects that fall outside of the anticipated natural progression of the disease?
Yes, sir. It is. No, actually, it is because most of the cases, the repertorial result was influenced, sir, by the Berkeley Square repertoire. That is the only reason I have given influencement to almost all the patients.
Okay, and then I have one more question, and that relates to the last statement under the results, where you say that physical and mental general symptoms quickly improved. Are you able to explain the effect of a nosode on the mental and physical general symptoms of the patient? Because our understanding is that finding a similimum is most likely to address those aspects of the case. And so we're working with a sort of generalized understanding by applying a nosode, and yet we're producing very individual effects. Can you explain that?
Sir, actually, there is a rubric that fear and anxiety in Berkeley Square repertory. So that in that rubric also considered the influenza is given under that rubric. So it is also covered. That's why I told you, because most of the people are under very anxiety and fear, sir. So that rubric also taken. That's why I included that generals also considered.
Okay. Okay. Thank you.
Thank you, sir. Thanks.
Want to tell a colleague of mine, Dr. Takac, he has also used in many cases of patients who are hospitalized. He used influenzinum, and in some patients he used tuberculinumab as a second remedy. So I think influenzinum might be relatively similar to corona. And of course, there's not enough experience, but in many cases, influenzinum improved the state of the patient in the hospital.
Mm.
Thank you, Dr. Frass.
Thank you. So thank you, Dr. Senti, for your presentation. We have here Dr. Monica Beyer to start the presentation.
Sim,
Welcome,
obrigada.
Doctor. Obrigada. Please share your screen, Dr. Monica. Could you zoom it, please?
Ok?
And
Podem ver?
la
Ma'am, the
puede
icon on the
expandir.
top.
La puede expandir para ver un poco más grande.
Expandir.
En el más. Perfecto.
Ok?
Ok.
Bom dia a todos. Vou falar sobre a autoexperimentação de molibdênio metálico. Nós fazemos experimentações na minha escola há 30 anos. E já experimentamos todos os elementos da tabela periódica que conseguimos obter na forma pura. Um deles é o molibdênio metálico. Nós, da nossa escola, seguimos os passos de Samuel Hahnemann, que usava na sua clínica os medicamentos que ele mesmo experimentava. Nós experimentamos os medicamentos, registramos os sintomas e usamos na nossa clínica para pacientes com doenças crônicas, ditas incuráveis e que se curam com os medicamentos que por nós foram experimentados. Esse medicamento, o molibdênio metálico, ele despertou em mim muitos sintomas. Sintomas em que eu me sentia muito presa, que eu não conseguia ter impulso para frente, sonhos que eu precisava de impulsionar as coisas, uma certa pendência que ficava na minha vida que eu não conseguia resolver, além de muitos sintomas de prurido nas pálpebras, sintomas de cantigas que eu desenvolvi, e pude reconhecer já em vários pacientes na minha prática clínica que se curaram de enfermidades muito graves, depressão, disfunções da tireoide, pacientes com úlceras gástricas que não curavam. E o que nós mais aprendemos com essa prática e que queremos mostrar para vocês, que quando nós experimentamos o medicamento e sentimos em nós o que aquele medicamento é capaz de curar no doente, a capacidade de reconhecer esse medicamento é muito ampliada. E as respostas clínicas do medicamento que eu experimentei são muito superiores aos medicamentos que eu uso de outros experimentadores. Então, nós queremos trazer para vocês a importância para o médico homeopata de conhecer os medicamentos em si, a partir de si mesmo, daquilo que o medicamento é capaz de despertar nele, no médico, e esse médico é capaz de reconhecer no doente os sintomas semelhantes que ele experimentou em si mesmo. E estes resultados são extraordinariamente superiores. Nossa prática há mais de 30 anos com esse modelo demonstra isso. Segundo Hahnemann, o médico precisava ter os medicamentos que ele conhecia com certeza, que ele conhecia por si mesmo, para ter os verdadeiros instrumentos para a cura. Então, a conclusão que nós tivemos, a partir desse método, que é o método hahnemanniano de pesquisa, a pesquisa de Hahnemann foi em si mesmo e o reconhecimento demonstrou que aquilo era verdadeiro e capaz de curar. Mostrou em molibdênio essas polaridades de agarrado e de potência e de preso, incapacidade de resolver os problemas, ao mesmo tempo a necessidade de um impulso. Foram reconhecidos numa jovem depressiva, que não conseguia sair do lugar, num senhor que tinha úlceras e que ficava com muitas pendências na vida, não conseguia resolver, em outros pacientes, uma senhora que tinha uma disfunção tireoideia há muitos anos e que não conseguia resolver as suas pendências também, curados com o molibdênio. E conclui-se com isso que quando o médico, o provador é o próprio médico e ele disponibiliza os seus sintomas e reconhece no paciente, é uma arte de curar extraordinária, capaz de fazer muito com muito pouco. Muito obrigada.
Thank you, Dr. Monica. For the participants, some remarks about this presentation. This is an experimentation with molybdenum metallicum, and they use a potency of 30 ch for chronic diseases, and they observed from the symptoms incapacity to solve problem, depression, gastric ulcers with no resolution, and vomiting, detachment, lack of personal power, and impotence. So the conclusion is that this is an important remedy to solve this kind of symptoms of the patients. I don't know if maybe anyone have a question for Dr. Monica? No, I don't. I don't see questions for you, Dr. Monica. Thank you very much for your presentation, and we continue with the next section. We finish this section of this part, so now we are going to start with the topic emerging new infection and antibiotics resistance. So we invite to Dr. Dumitrescu Noica from Romania and Cornelia Angelica for their topic, homeopathic nosodes, an alternative to the treatment of multi-drug resistant infections. Welcome, Doctor. Please
Hello.
start your presentation.
Hello. I don't know where I can share screen. Yes.
Yes.
Share screen.
Maybe you can zoom it, please. Thank you. Please start.
Yes. I make this work because I wanted to prove more to my allopathic colleagues about the power of homeopathy and how much it can help us in solving sometimes hopeless situation. Since I learned in homeopathy about nosodes, I apply them daily to all my patients infected with various pathogens in the hope of cleaning up their genetic code from the disturbing information generated by these microorganisms. From clinical and paraclinical observation, I have seen that I can solve the trailing and resistant infection, multi-drug resistant to antibiotics, with homeopathic nosode specifics to each species. In this work, I have started with a case of mine, an 8-year-old boy who, at an annual examination at the blood test, I found this his slow titer increased, and in the pharyngean exudate, I found Staphylococcus aureus. At the first, I gave him the specific antibiotic for this infection, for his infection, Ospen for Streptococcinum and Streptococcus, and Oxacilinum for Staphylococcus. But I told his mother about the possibility of treatment with homeopathic nosode, Streptococcinum and Staphylococcinum. But she refused them because she have to buy them compared to antibiotics that they receive for free from the public health insurance. And on another hand, she said she did not have trust in the homeopathic remedies. So I give just the antibiotics, but at the next checkup, I found Oslo titer even higher, 1 mil for 140, 410 international units for per milliliter. The child's mother requested a referral to the pediatrics, who recommend moldamine, penicillin C injectable. With now here easy to go to the baby's injections. He comes to me to do them. We all three have struggled with this for a year, during which time Oslo did not normalize it, but fluctuated between 742 and 327 unit international units per milliliter. Finally, they agreed to take streptococcinum M mille, because in the meantime I got it and gave it to him for free. At the next blood test, the Oslo came down to 200 international units per milliliter. After a few years, I found again this Oslo titer slightly elevated, following a common cold. Meanwhile, reading Peter and Michael D'Adamo books, Nutrition According to Blood Groups, I understood that those with blood group A or AB cannot defend themselves against Staphylococcus G and Streptococcus G, because the protein that determinate the antigenity of the group A resemble to the protein which determinate the antigenity of this bacteria. Then I thought about the following treatment scheme. Streptococcinum or Staphylococcinum or another nosode in 2000 CH or mille once a day for 3 days. Then Streptococcinum or Staphylococcinum 200 CH or mille once a week, then at 2 weeks, and then at a month. But for those which blood groups have A or AB group, I spoke to take once a month preventively, repeating in the acute scan wherever they have a cold or another emotional stress and disrupt their immunity. In order to convince my allopathic colleagues, I thought to give to a laboratory various homeopathic nosodes and to make comparative study between the antibiogram with antibiotics and the antibiogram with the homeopathic nosode. Microbiologist Liliana Tuică agreed to help me and did this experiment, taking into account all the scientific rigors necessary in prepare the samples. In the basic paper, I present for a urinary infection with Escherichia coli and another with Klebsiella. Because unfortunately it could not fit in the poster, but in the basic original paper there are a lot of another samples with Staphylococcinum from nasal exudate Streptococcus agalactiae, from a vaginal secretion, and the other one with Candida species. It has been clearly observed that these homeopathic granules are not simple sugars granules. They indeed contain active information and or even in vitro. It has also been observed that they have an effect regarding of the potency. Only one in the Candida had not inhibitory effect to 7 CH potassium. CH potassium. I also noticed that by using this homeopathic treatment scheme, I managed to decrease the recurrency and even to solve in the long term various recurrent infection and multi-resistant to antibiotics infection. I also noticed that after a while, if they happen to replace, they would even become sensitive to the antibiotics that in the past they were resistant. This is my concluded. This is my conclusion of my presentation, and any questions are welcome. Thank you for listening to me.
Yeah, Angelica, how many cases have you treated with nosodes before coming to conclusion? Yes, they are helping cases which are treated with antibiotics and they are antibiotic resistant. How many cases have you treated?
200.
200.
Yes. Yes.
Okay. But you didn't present the data of those 200 cases. Even if it, they are different cases. Yes. But they had something in common that they were all, drug resistant, antibiotic resistant cases.
Yes. Yeah. And
yes. Okay. That's all from my side.
So I understand it was just one day, which is C200.
I don't understand. It's a question.
It was just one day, and you used CH200.
Yes, I like to use 200 because according to Ernest Low, 200 is inhibitory potential. It's a good inhibitory potential.
Okay.
Thank you, Dr. Cornelia. We continue with our next presenter. I welcome Dr. Aman. The doctor is going to present about tautopathy. Welcome, doctor.
Dr. Aman is not present.
Dr. Aman is not here. Well, we continue with the next.
Absolutely.
Perfect. So welcome, Dr. Ankur, with the next presentation.
Namaskar, Hanemanian greetings from India. And here is a small presentation which is an observational study in the pre-COVID era. The data is before December 2019, and I'll be telling you why the data is before 2019. So preventing antimicrobial resistance in pediatric age group, the homeopathic perspective. Now, why do I want to tell on antimicrobial resistance, especially in a setup like India, is simply because feel surprised, but in Indian scenario, even without a prescription, getting antimicrobial from the pharmacy is as easy as buying a chocolate. So there are parents and there are caregivers and caretakers who are taking these medicines every now and then the result is that higher generation antimicrobials, higher generation antibiotics, sometimes antivirals, and other remedies are being misused, and they are causing a great amount of resistance. So to prevent suffering, parents' anxiety, and the ease of use, recurrent antibiotic use, oral as well as intravenous, has been gaining popularity, at least in India and even world over. There have been WHO concerns about the antimicrobial resistance, and so we have Antimicrobial Awareness Week, where the resistance needs to be kept at bay, otherwise we will run out of these sources. So to avoid the multi-drug resistance, especially in the pediatric age group, and to give the younger children, the children of the future, a beautiful youth and a good old age, we need to take on to homeopathic management. The cases are selected randomly from my OPD practice. The cases have been selected as per the antibiotic usage, and the antibiotic usage frequency was 4 to 6 cycles, sometimes 10 cycles per year. We have been talking with the patients and the parents, and we have started giving certain medicines like belladonna for common cold and fever, arsenicum album for diarrhea, and nux vomica for nose block and vomiting, drosera for cough, arnica for bleeding and other injuries, all in 30 potencies to start with. This was done along with the individualistic homeopathic medicine protocol, where the individualistic homeopathic medicine was chosen on the basis of the presenting totality, as well as keeping in mind the family history, the past history, and all the homeopathic principles were kept as the guideline. We admit that we have not been able to use the mental symptoms because the mental symptoms available cannot be confirmed, and sometimes the parents do exaggerate a lot. So we did not want to take any mental symptoms for our medicinal selection, but definitely later on the psychological picture, the patient's anxiety and everything came to forefront, and we could help that with the individualistic homeopathic medicine, and sometimes the nosodes were also given. Now all these cases have been studied for quite a while. We have done analysis on the basis of available data that patients have to be followed up for minimum 1 year. If the patient has not followed up for 1 year on homeopathy medicine, we have not included such patients. So 80% of those patients who have been found to be on homeopathy for more than a year, they have been healthy, requiring less antibiotics. Almost all of them did not require any IV antibiotic. I feel that that is a major achievement. Another little achievement from the homeopathy standpoint or homeopathy point of view was that these children could have regular schooling. Their scholastic performance did improve. Not only that, they have been gaining normal height and weight. Please mind that India is having a great amount of children who are malnourished or undernourished. So even the nutrition part needs to be kept into account or kept into our focus. And with homeopathy, these children have maintained that at a good level. in a long run, when we have been observing them for more than 2 years, the kids who regularly take homeopathy medicines for their ailments, they are not requiring to take frequent antibiotics. From 5-6 cycles a year, it is less than 1 cycle per year. Another major milestone achieved. And these kids are on homeopathy medicines for their viral fever, gastric upset, diarrhea, vomiting, certain allergies, injuries, or acute bronchitis. And they are taking indicated homeopathy medicines. Another point to be noted down is that their doctor phobia has reduced. They don't want to hide anything. They have developed a good rapport with the homeopath. And most importantly, as they have turned youth, even their youthful symptoms or the symptoms of puberty can also be taken care by such a homeopathic consulting over a long period of time. And this is what could be achieved, and it has been observed in this particular study. Concluding, the cost-effective homeopathy therapy is much better than the higher generation costly antibiotics. The sweet pills are always loved over the bitter doses of antibiotics. Now, there is an urgent need for all the regulatory authorities over the world to consider the use of homeopathy, especially in pediatric age group, for minor ailments, so to avoid the antimicrobial resistance. And in a long run, this practice will help the growth of homeopathy, and the conventional system allopathy will also be benefited from this practice. I have the complete master table of the kids who have been given these medicines. Should there be any need to present that, I'll be happy to share the same. And with this, I conclude this presentation of mine. Again, Hanumanyan greetings from the land of India. Thank you all very much for this presentation. Thank you, LMHI.
Thank you, Dr. Desai. Any questions from the chairs?
Dr. Ankur, you have very well presented your case and you have done justice to the title of your topic. Okay. But the thing is, it was a poster presentation. There was no poster. It was a case presentation, right? Here it is a poster presentation competition. So
perfectly well directed, ma'am. This was a last minute entry, number one. And number two, since the poster could not accommodate the data, I have this master table on display. I'm sorry if I'm not meeting with the criteria of poster presentation, but at least, the Indian practice or Indian scenario is in need of such a kind of awareness. I would be glad to share that there was one authority who was telling that even the government is thinking that let us give more weightage to homeopaths in acute setups, at least to avoid the unnecessary antimicrobial presentation. So I thought that this would be one of the arena where I can present my views or the views in the international forum where India differs in pediatric practice. If it is a Western country, we have to follow the norms and no antimicrobial or antibiotic is available without a prescription. In Indian scenario, it is available. Hence, this needs to be addressed. And I have tried my best. Lacuna is all mine. But if there is any benefit, the fraternity may take forward from what I have lapsed or left. Thank you, ma'am, for that comment.
I have a question. I think equally important as in kids, it is important that animals are also fed with homeopathic medicines or treated with homeopathic medicines instead of antibiotics. At least officially in Europe, there's a One Health plan, and it says primarily you have to treat animals first with homeopathic medicine, and only if it doesn't work, then you should use antibiotics. Is there a similar law in India? Because, at least the ones who are not vegetarian, it may be important that the meat you are eating is not confused with or mixed with antibiotics.
Let me share something, Dr. Frass. In India, the level of antibiotics in plants and poultry is much above the acceptable limits world over. So even the vegetarians and non-vegetarians are developing antimicrobial resistance even without taking antibiotics. Now, where this is leading? In a pediatric practice, the higher generation, the fourth or fifth generation antibiotic to be used is a routine, and IV antibiotics are literally abused. I'm sorry for the words, but they are literally being misused. So in that scenario, how homeopathy can help needs to be studied at a broader level. This is just a beginning. I know I have a long way to go, but then someone will have to start. A lot of us have started, and we will definitely go some way. Since the great soul, Dr. Hahnemann, is our guide, we will be doing something good for the fraternity, sir.
Shall we
Thank you,
proceed?
Doctor. Thank you, Dr. Ankur, for your excellent presentation. We invite the next presenter, that is Dr. Amarilis de Toledo, who is going to present Coronium report of the experience with COVID nosol in homeopathic Brazil. Welcome, Doctor.
He's not in the panelist, I think.
Oh, is that Dr. Amarilis? Well, maybe if connects later, we invite our next presenter, that is Dr. Pedro Alberto Sierra from Colombia. He's going to present the basic nosodes, their interpretation from a pediatric perspective. Bienvenido, doctor Pedro Alberto Sierra. Por favor, puede compartir su presentación. Is Dr. Pedro present?
He's not there either. Let's proceed to the next.
Yes. So
let's proceed to the next section.
Yes. The next section is the topic of homeopathic within traditional complementary integrative medicine. We invite Dr. Rodrigo Lozada Rivera from Colombia. Bienvenido, doctor Rodrigo.
Buen día para todos y para todas.
Por favor, puede compartir su presentación. I'm going to make some remarks in English from the presentation from Dr. Rodrigo.
Bueno, no sé, voy a comenzar. ¿Qué hago, Adriana?
Sí, por favor.
Bueno, buen día para todos y para todas. Soy médico, trabajo acá en el departamento del Cauca, al suroccidente de Colombia. Llevo trabajando más de 20 años con las comunidades indígenas de acá del departamento. Y bueno, mi trabajo sobre coca nace precisamente de una inquietud. Y es que la coca pues tiene una presencia milenaria en las comunidades ancestrales de toda nuestra Suramérica, incluso Centroamérica. Y de la parte de homeopatía me preocupaba mucho que nosotros pues nunca la estudiamos, la coca, ni se estudia, ni mucho menos se usa la coca en homeopatía. Entonces, mi inquietud radica desde ahí y obviamente entonces decidí investigar qué es lo que pasaba con la coca desde el punto de vista homeopático. Entonces realicé una investigación etnobotánica, realizando 2 entrevistas a 2 médicos tehualas, es más o menos sería como el hombre sabio o el médico tradicional de la cultura nasa, un hombre y una mujer. Realicé una revisión de la patogenesia de la coca y de todas las materias médicas que pude encontrar. También realicé una revisión no sistemática de artículos y libros donde se encuentra la coca. Realmente, si uno busca en buscadores como PubMed y otros, lo que uno encuentra entre coca y homeopatía casi es muy poco, solamente unos poquísimos artículos que hay. Y luego realicé una comparación y contraste entre sus usos. Lo que pude encontrar, digamos, y en mis largos años de experiencia, es que la coca, cuando ellos mascan, o sea, el médico tradicional o tehuala masca la coca, siempre la masca con una sustancia adicional. Nunca la masca coca, generalmente la masca, en el caso del pueblo Nasa, acá el departamento del Cauca, la mezclan con una sustancia que es una piedra caliza que se llama mambe, y esto potencia el efecto de la coca. Y es muy importante porque en la medicina ancestral nuestra hay un principio de complementariedad. Nunca se usan generalmente las sustancias solas, siempre se usa con otra sustancia. Entonces, lo otro que encontré es que realmente la coca se usa en casi todo. Cuando tú vas a la consulta del médico tradicional, siempre tú tienes que llevarle la coca. La coca se usa seca, como vemos ahí en la foto que podemos observar. Este es un poporito, es una calabaza que contiene el polvito o mambe que ellos utilizan para mezclar en la boca cuando mascan la coca. Tiene muchísimos usos, tanto en el sistema digestivo, el sistema nervioso, el sistema urogenital, siempre está presente la coca allí. Y una cosa muy importante, y es que ayuda a la formación, es decir, el médico que se quiere formar como médico tradicional debe aprender a mascar muy bien y a utilizarla en su formación espiritual. Del otro lado, en la patogenesia de la coca, se usaron muchísimas formas de la planta, desde el mascado, las trituraciones, las diluciones, pero también es muy importante que se usó no la coca, sino la cocaína. Se usaron inyecciones de cocaína, lo cual desde nuestro punto de vista pues representa, no es lo más adecuado, porque cocaína no es igual a coca, y esto es una de las cosas que quiero dejar clara aquí. Y además que la coca que se utiliza acá, como la estamos viendo aquí, o en la lámina de arriba, esta fotografía es tomada en un resguardo aquí en el departamento del Cauca. Es una coca especial, es una coca ancestral. La coca que se utiliza para, digamos, para la elaboración de la cocaína es otro tipo de coca, es otro tipo de variedad, de familia. Y entonces creo que es importante que tengamos en cuenta esto ahí. Frente al lado de la homeopatía, entonces la patogenesia, aunque presenta síntomas mentales y en otros sistemas, realmente cuando nosotros vamos a verla en el repertorio, pues los síntomas que presenta son demasiado pocos comparándolo con los policrestos. La investigación sobre las revistas, lo que podemos ver es que realmente lo poco que hay, lo que sugieren los investigadores es que se continúe la investigación de la coca, y que podría ser muy útil para el tratamiento de diversas enfermedades, entre ellas para el mal de las alturas, la diabetes y, por ejemplo, para las adicciones. Ese es un tema que me interesó a mí. Como conclusión, entonces, podemos decir que la investigación de la coca con los tehuala, la revisión del estado del arte y la materia médica permiten concluir que la utilización de la coca como medicamento podría ser más amplia para el tratamiento de múltiples patologías, incluyendo el tratamiento de diversas adicciones, para lo cual se necesita que se tenga en cuenta el conocimiento y la forma como se usa la coca en las comunidades ancestrales para realizar una nueva experimentación, la cual se haría utilizando una mezcla de hojas secas de coca con mambe mediante trituración. Eso sería más o menos lo que yo quiero decir, y agradecerles que me escuchen en español.
Gracias, doctor, por su excelente presentación. I'm going to share some remarks about this presentation. Dr. Rodrigo was talking about the ancestral knowledge from experimentation of coca as a traditional leaf in the Colombian and all the Andean culture. He did non-systematic review, interviewed 2 traditional doctors from the NASA culture, that is an indigenous people here in Colombia. And he applied ethnobotanic research. So as you know, the traditional use of coca leaves is mixed with an stone, and they produce something that they call mambe. This mambe has very many medicinal properties that is used from centuries. And because in traditional medicine, they don't use alone the coca leaves, they use another ingredients. And the traditional uses are urogenital infections, diabetes, addictions, fatigue. So also during the formation of a traditional doctor, they use the coca leaf for spiritual properties. It's important to know if we are going to make an experimentation or approving from a coca dilution, we need to take into account that we cannot use just the coca leaves. We need to use a mixture of coca leaves and also mambe, because it's another product from the coca leaf. And it's very important to understand that cocaine, the drug, is not the same that the coca leaf that is used in the traditional communities. And for the conclusion from Dr. Rodrigo is that the use of coca leaf could be more, and we need more proper research using in more clinical trials the correct product in homeopathic dilution. And that was, I don't know if someone of the audience or the chairs wants to make some questions to Dr. Rodrigo.
In how many cases you have tried this kokum leaf and mariligo?
Doctor Rodrigo, usualmente, ¿cuántos pacientes ha utilizado usted la coca en alguna dilución homeopática o la hoja de coca en algún tratamiento?
En la coca se usa aquí para todo, como bebida, para fatigas, pero no lo ha hecho digamos, en diluciones, no lo ha hecho. Siempre se utiliza la hoja seca. Puede ser en maceración, en polvo, se masca la coquita directamente, o se hace infusiones en té de coca, pero no la ha hecho digamos, en diluciones homeopáticas, no lo ha hecho.
Dr. Sanjita, Dr. Rodrigo said that they use in the daily practice for all patients the coca leaf, not the homeopathic dilution. And they use it directly, the dry leaf in the mouth, and also as infusions.
Also in
infusions, in tea.
In tea, okay.
Yes.
Fine. It is used as a traditional medicine then.
Yes.
Okay.
Also in Bolivia, you can see that in Bolivia.
Yeah.
For the high. Yes.
Okay. So in number of patients, they have tested this. The effect of this leaf, kokum leaf.
He's not tested as a proper clinical trial. They use, all the community use daily this infusion as part of the lifestyle.
Okay.
Adriana, puedo decir, acá en el departamento del Cauca se realiza un festival gastronómico, y este año el festival gastronómico tuvo como elemento central, se preparan helados, tortas, sopas, todo con coca. O sea, el elemento central es la coca. O sea, además de ser medicinal, se utiliza en la alimentación porque realmente la coca es un alimento que tiene un elemento proteínico y minerales muy importantes, ¿no?
Also, Dr. Rodrigo add that there is a festival in Cauca, the zone where he is living, that is not used as just as medicinal properties, also a culinary properties, because there are studies that the coca leaf has minerals, proteins, and other kind of ingredients that are very important in the nutrition of the community. So it's focused this festival in the use of some different kind of foods.
Yeah, that's very nice. If they can actually use it or prove it, to use it as a medicine, let it be in the form of leaf, some decoction or some form, so that everybody else also around the world can use it. I mean, it should come out, not only, all the symptoms, but everything, its toxicity, everything, every study, should be done so that everybody can use it. That is the point of integration. Like, we would like to use this medicine even here.
Thank you, doctor.
Okay, thank you. Thank you, Dr.
Muchas gracias.
Rivera.
Gracias, Dr. Rodrigo.
Gracias a ustedes.
So we continue with our next presenter, that is Dr. Nilima from India, who will talk about homeopathic similium with acupuncture, 5 elements, and balancing meridians. Welcome, doctor. We cannot hear you, doctor. Maybe you need to unmute your microphone.
Dr. Nilima, please unmute yourself. Dr. Nilima, please unmute yourself. Your microphone is off.
Yes, I'm sorry. Yes, now can you all hear me?
Yes, we can hear you. Please proceed.
Okay, thank you. Thank you, LMHI, for conducting such a wonderful conference, the virtual conference, which is excellent in its kind. Thanks to all the present moderators and the organizers. This is a poster presentation, and my subject for today is going to be the integration of homeopathic and acupuncture. I am a homeopath since last 30 years, and I have been practicing acupuncture since last 15 years. And me and my husband, Dr. Hemant Thakkar, who's a co-author also here if required, he will also add on certain things with the permission of the chair. He practices mainly acupuncture and is also the council member, Maharashtra Acupuncture Council member present. So anyways, let me start with the integration part of homeopathic with acupuncture. Here, the discussion is basically on precise homeopathic drugs which are relevant to an acupuncture point. Now here let me go back to 1947 where Dr. Raja, this is the thesis what I have read, and I have started practicing since last 10 years and found the results, and that is why I am here to express my knowledge on this with the very good curative effects and results. So it was found, finally it was found in 1947 by Dr. Roger de Louet that there are relevant homeopathic medicines related to acupoints. If I go back II, the founder of homeopathic, Dr. Samuel Hahnemann, way back in 1843, he had also described the illicit points, the painful points. He could not go ahead in further researching on those painful points. He inclined himself more into homeopathic medicines, the research in homeopathic medicines, and this was further on studied by his students, the YA family and Dr. Redmesher in Germany, where they found out there are specific relevant points related to each and every acupuncture point. At that time there were around 270 points which were discovered related to the relevant homeopathic medicines. So in my first presentation here, be very clear. I have shown the acupuncture points like lung 1, lung 2, lung 3, etc., which are precisely connected to a very relevant homeopathic medicine by research. I am just following this, and with my further understanding, I have found out that the theories of acupuncture, the philosophy of acupuncture, that is 5-element theory, yin-yang theory, the theory of 8 principles, which is all shown here. These are the points which I have shown, the acupuncture meridians which I have shown, and over here I have shown the theory of acupuncture, which cannot be described. It is quite a lengthy subject, and of course the organ clock theory, which is mentioned here. So all these theories, like in 5 elements there are wood, fire, earth, metal and water. These are the energies which are present in the body. These are the celestial energies. We all know that if there is excess of wood element, the storm etc. comes into action even in nature, or if there is excessive fire, what happens in nature. So these are the celestial energies which are present, and these energies are also present in our body. And in acupuncture it says that these energies, when they are disturbed or disharmonized, that is, there is going to be a disease in the body. So there are certain acupuncture points like 5 shoe points which I have shown here. These points are supposed to be the polycrests in acupuncture as in homeopathic, and then there are related homeopathic medicines to that, which was already discovered. And then there are 5-element remedies also which are mentioned here. If the poster is not very clear to you, I can read it out over here. The relevant remedies, and of course I am reading from my poster snaps, because I am sure this is not very clear. The posters are not very clear over here. So the 5 elements and the points. So let me describe you little bit of the 5-element theory for your understanding. That the wood element, this element is related to liver and gallbladder of our body. The color which is absorbed, chosen, expressed by this energy is green, as in bile, you can understand. And the emotion of wind being anger, and it is rather yang. See, there are yin and yang theories, and the expression of wind is yang in its nature. And the relevant remedies which are found are pulsatilla, rustox, nux vomica and lycopodium. So as into, when I go back to the fire element here, the remedies being, it is in the normal state, the fire element influences the organization of ideas in a logical, communicable and understandable language. Therefore, communication is the central theme of this fire element, and most of the hot remedies in homeopathic like sulfur, iodine or coffea, they relate to this. So I can mention all the elements, the earth elements which relates to the energies and the imbalances in the stomach and spleen meridians at all levels. That means in terms of digestion, transportation and transformation of the food. The color being yellow, the emotions of this meridian which is expressed is, buried in thoughts, pensiveness, ruminating thoughts, dampness, and this element is neither yin or yang. Its deep sensation is of security, or you can call it insecurity. Here you have the reasons for comfort eating, bulimia and some cravings. So by mentioning this theories or the symptoms of each element, you can understand that how we can think of a precise homeopathic remedy pertaining to the symptoms. Now the metal characteristics relates to lungs and large intestine, the color being white. Dryness is the element, the emotion is of sadness, and rather it is an yin. The remedies, what we can think of it over here is calcarea, bryonia and natramur, and of course many more. So again, when I come to the water element, it is related to kidneys and bladder, urinary bladder, the color being black, the emotions of fear, cold, and this is the most yin of all the elements. The drugs what we can take, the homeopathic medications what we...
Dr. Nilima,
Yes.
I would request you to kindly please quickly wind up. We have other presenters in queue.
So I am beyond the time?
Yes, please do.
Okay, I'll be quick. Okay, you can give me one more minute. The drugs being here are asnical, lycopodium, silica, mercurius being mainly pertaining to the water element. So here what I am trying to express is all the elements relate to particular symptomatology, and these symptomatologies can fit into a precise or a relevant homeopathic drug which has been discovered earlier by the masters and the authors here, and this is what I feel that to have a fantastic curative effect one should try and learn this to practice. Thank you all.
Any questions from the chairs? Dr. Ashley?
Thank you, Dr. Thakur, for that presentation. I hear what you're saying in the sense of aligning element theory to characteristics of homeopathic remedies. But my question is about the more subtle and nuanced interpretation of that. I understand that as humans, we want to relate things that we recognize, and if we're working in two medical systems, we will find the connections between those two systems. But
Yes.
my understanding of elemental theory in Chinese medicine is that there's often an interplay of elements, and not just, you would not have necessarily a disturbance of only one element. And similarly, a homeopathic remedy, although mercury, for instance, may be very strongly associated with the water element, it may not be exclusively water in its nature. How in a practical sense, how do you work with the...
Yes, doctor.
Clarity between, in its cleanest form, you can see the match, but many of our patients are inhabiting a space somewhere in between, and it's in the in-between that we differentiate our remedies. And my understanding of TCM is that also your diagnosis.
Yeah, I'm sorry.
So how does that relate?
Is it okay to repeat the question?
I don't know if I'll repeat it exactly, but I understand that when we talk in very clear classifications, so if if we talk about the water element exclusively, we have certain characteristics, and we may talk about a remedy exclusively in relation to that. But the
Yes.
reality is that most patients are not necessarily squarely having a problem with one element. There's often an interplay between elements in terms of elemental theory. So we wouldn't necessarily always have, strictly speaking, an exclusive water imbalance. There may be a fire aspect or a wood aspect, for instance. And similarly, in our homeopathic remedies, although we may recommend recognize a remedy like sulfur as being very much associated with the fire element, not all the symptoms of sulfur are fire. So how, in a practical sense, how do you deal with that, the grayness of both
Yes.
elemental theory and of homeopathic materia medica?
Yes, this is where I have the answer of diagnosing with 5-element theory, where there are principles of subjugating or anti-subjugating an element which is in excess or deficiency in a person, and this is where acupuncture comes into its role. Second thing, what we do is we diagnose the element by even assessing the pulse and the tongue. So we come to an excessive element and of course a little less excessive element also. So then we treat the patients layer by layer by removing the surface problems, and then after a few sessions coming down to a precise elemental imbalance. And this is where it is not necessary that we always add homeopathic at the first instant, homeopathic prescription at the first instant whenever the patient comes. And we always take a very particular type of patients where both the things are required simultaneously, like obesity or hormonal imbalances or PCOS, or very acute the patient is very in acute pain. So this is where we simulate both, not in all the cases.
Thank you.
Yeah? Am I clear?
Yeah, I
Yep.
understand the interplay and trying to move to a point of clarity. And at the point of clarity, you will try to achieve the match. I get that. Thank you.
Thank you. Thank you.
Dr. Nilima, I would
Yes.
like to, in fact, congratulate you for giving us a very interesting presentation. And it is a finest, I mean, we can say case where you have integrated acupuncture with homeopathy. So this is what we can call justice to the title, homeopathy within traditional complementary integrative medicine. So TCIM has been fully justified.
Thank you so much. And I'm honored with your compliment.
Yeah, it has been, acupuncture we know has been used in many cases, even allopathic doctors are using it.
Yeah, and we are very selective in where to give this integration.
That's right.
Yeah. Thanks.
Okay.
Thanks a lot. It was my honor. Thank you so much.
Thank you, Dr. Herman, for your presentation. We kindly invite our next presenter, Dr. Sonal from India, who is going to talk about homeopathy within traditional complementary integrative medicine. Welcome, Dr. Sonal. Please share your presentation. Dr. Herman, you can mute your microphone, please. Thank you.
Good evening, all. Yes. Hello, everybody. My today's topic is homeopathy within traditional complementary integrative medicine. Integrative medicine is a type of medical care that combines standard medical treatment with complementary therapy that have been shown to be more effective and reliable. It will treat our mind, body, and vital force. Integrative medicine is a holistic approach which takes into account a life habit of a patient. Here we treat the patient as a whole, not only just the disease. Research shows that some complementary medicine, when combined with standard treatment, it will give very good result, especially for treating chronic disease. It is always better to combine standard treatment with complementary medicine. This is known as integrated approach. So integrative medicine can help the people with cancer, hypertension, diabetes, and many other conditions. This integrative approach improves quality of life by reducing fatigue, pain, and anxiety. The use of traditional and complementary medicine is widespread in developing countries and it steadily increases across the world. Traditional complementary medicine, although beneficial, but due to it is although beneficial, is often not supported by scientific evidence. So hence scientific evidence is required in order to prove its efficacy. Hence here an attempt is done to show the efficacy of homeopathic medicine as an complementary medicine with combining with standard medical treatment, especially in cases of cancer. This therapy, especially homeopathic therapy, when combined with standard cancer treatment, it can help the people to cope up with the treatment from the cancer, as well as it helps to remove the side effect of chemotherapy, radiotherapy, as well as it relieve the symptom. It gives symptomatic relief to the patient. As we all know, hydrostis is a very good drug for cancerous affections. The study was conducted at the OPD of Dr. V.H. Dave Homeopathic Medical College, Anand, Gujarat. Cases were enrolled during year 2017 to 2020. They were observed at every month for the period of 3 years. Aim and objective was to verify the usefulness of hydrostis mother tincture in a patient with a cancer as a complementary integrated approach. This study design is retrospective analytic case series. 15 in inclusion area criteria, the 15 diagnosed cases of cancer with allopathic treatment irrespective of type of cancer. While in exclusion criteria, cases with irregular follow-up and cases which were not prescribed hydrostis mother tincture. Along with allopathic treatment, hydrostis mother tincture was administered to each and every patient and data collection was done by personal interview method as well as from the college case records. And statistical analysis was done with the help of PET-T test by using microscope, pre-treatment and post-treatment score with the help of MyMove symptom score, as well as some work done. Result: out of total 15 patients were under observation, from where 8 patients were of male and 7 patients were of female. In male patients, we are having 3 cases of CA tongue, 1 case is of CA esophagus, 1 is of CA pancreas, and 2 cases are of CA prostate. While in case of female, we are having 3 cases of CA breast. And maximum number of the cases were between 40 to 60 years. That is, between 40 to 50 years, we are having 5 cases, and 60 to 70 years, we are having 6 cases. And in result, it was found that in each and every patient, we are having good improvement with hydrostis mother tincture. Because in this study, patient was asked to narrate about more troublesome symptom along with their symptom like appetite, weight, activity, all over sense of well-being. And in conclusion, it was found that there is a good utility of hydrostis mother tincture and remarkable improvement is present in pre and post treatment score. And one more important thing is no metastasis was found. And like I would like to add, like in hydrostis mother tincture, we can have many other drugs which will help us to treat this kind of the cancerous patient. Like if the patient is having bad effects of chemotherapy, at that time we can give our drug like cadmium sulfate. if the patients are having bad effect of radiotherapy, then we are having drugs like Epicac, Nux vomica, Sol, etc. It will be useful. If the patient is having bad effects of anesthesia, that is, sometime we see that okay, operation will remain long last. Doctor will say it will take only 1 hour, but operation will take more than 1 hour. At that time, patient may have chance to get the bad effects of anesthesia. So at that time, we can use the drug like phosphorus. As well as we are having the most important drug, that is euphorbium, which will relieve all the burning pain of the cancer. Especially, it will help to relieve burning pain of the cancer. And whenever there is a burn from radiation, at that time we can treat it with the calcarea floor. So main aim is when we combine our therapy with any other treatment, especially in cases of cancer, where the word itself suggests it's a horrible disease, and in past it was feel like that. Cancer means cancel. But nowadays it's not like that. With the help of standard medical treatment, if the surgery is required, at that time we are supposed to advise the patient to go for surgery. And along with it, our medicine can help and we can get well results. So it is it is a matter for proud for our system that here on 15 patients we are having no metastasis in any case, and all the patients are having all our sense of well-being. So it is my presentation on homeopathy within traditional integrative medicine, within the traditional complementary integrative medicine. Thank you.
Thank you, Dr. Sonal. Any questions for Dr. Sonal?
I would like to ask
Yes,
which types of cancer were treated in these cases?
Sir, yes, sir. We had taken the cases irrespective of type of the cancer. All kind of the cancers had taken into consideration, because as our institute is not a cancer research institute, but we are having all kind of the cancer, not any specific cancer, but in male. In Gujarat, because of habit of tobacco chewing, in Gujarat, in India, because of habit of tobacco chewing are more. So we are having more cases of CA esophagus as well as CA tongue. While in case of female, we are having 3 cases of CA breast and 2 cases are of CA uterus. 1 case is of CA esophagus.
And, what was the dosage? Can you please repeat?
Yes, sir. We have given hydrostis mother tincture, 10 drops BD in half cup of water for daily, along with allopathic medication.
Maybe you can write this in the chat so I can just read it once more.
Yes, sir.
Thank you so much.
Okay, sir. Thank you, sir.
Any other questions from Dr. Ross? Dr. Sangeeta?
Dr. Sonal,
yes,
why did you choose hydrostis? Though you have described many other medicines in the usage of cancer.
Yes, madam. But at that time, we are having all the patients which in which hydrostis was indicated, because in our inclusion criteria, it was we had taken only 15 cases in where hydrostis mother tincture was prescribed. That's why we have taken hydrostis.
It was based on symptoms or it was a drug specific criteria?
Both.
Irrespective of the case.
Irrespective of type of cancer, but mainly drug, specific drug, that hydrostis we had taken into the study.
Okay. Okay. We need actually much more number of such cases to be treated with hydrostis before we actually say, yes, this is really effective in preventing the metastasis, right?
Yes, madam.
Yeah. And the stage of cancer you have not defined, right?
Yes.
At what stage you have given
almost
stage of cancer?
Almost in a CA breast, we are having all the patients after operations. But in some cases, we have prescribed in 2nd or 3rd stage also. And along with that, allopathic medication as well as chemotherapy and radiation. But with our medication, the patient is having sense of all over well-being, as well as there is some improvement in appetite as well as in weight. So it is a very good to see the effect of hydroxys mother tincture in cancer patients.
Okay, good. That's all from my side.
Thank you, madam.
Okay.
Any
Thank
more
you.
questions?
Thank you, Dr. Sonal, for your fantastic presentation. We invite our last presenter, that is Dr. Andres Felipe Rodriguez from Colombia, who is going to talk about the historical context of traditional medicines as an integrative approach for epidemics. Welcome, Dr. Andres. Dr. Andres is connected.
Dr. Andres is not here.
He's not here. He's not. Okay. Dr. Shristi, I don't know if you have more participants on the list.
We are done with the participants.
Perfect. I don't know if Dr. Michael or maybe a Dr. Rose wants to conclude the session.
Yeah, I think in closing comment, I think there've been some really interesting presentations. So although I know I've asked some tricky questions, I think the presenters are to be commended on being brave enough to present themselves as they have. And for the most part, I think this has been a useful learning experience, both for the presenters and for those attending. So congratulations, well done. Thank you.
Dr. Sangeeta, do you have something to say? Dr. Frost?
I've
Hello.
no more questions. I just would like to thank all the presenters for the wonderful presentations, and I've learned a lot. And I think the good thing is that you can see that worldwide you have a very good, very well received homeopathic community, and I hope it will keep on. So let's stay in touch, especially also with antimicrobial resistance. I think this is very important, and also, of course, with anti-cancer treatment. So many greetings from Vienna. And
Dr.
I have
Sangeeta?
to excuse
Yeah,
now to leave because
few cases, you know, they were presented very well. I would like to congratulate all the presenters for their good presentation and the hard work they had done in preparing. And especially Dr. Pritha, she had done a very good work while presenting her RCT. And nowadays we are seeing like use of isopathy. This is a new trend which is followed by researchers for doing their research. You know, this is another field they have chosen now. So we had few very interesting cases, and in few cases we're not able to understand fully the other cases which were not in English. So we had some difficulty, but anyway, TCIM was very well presented. This topic was very well presented by Dr. Nilima and Dr. Sonal. So my congratulations to them. And of course, nosodes were also there. This is the new trend we are now seeing. And in the end, I'll just say thanks to everyone for, doing this good work, and they should continue with this work. You know, TCIM, the integration of homeopathy and TCIM is really needed. It is the need of the hour.
Thank you, Dr. Sangeeta, for such encouraging words. And also, I'd like to thank Dr. Ross and Dr. Frost for their presence. Thank you, Adriana, for kindly translating and hosting the event. I'd like to thank all our coordinators as well, Dr. Swati and Dr. Radhika, for managing all our backstage events. Thank you for attending this session. Hope to see you soon in the LMHI colloquium on 10th. Take care. Bye-bye.
Bye bye.
Thank you all of you, and muchas gracias a todos los participantes latinoamericanos que asistieron a esta sesión. Los esperamos en las próximas sesiones. And thank you all of you. Bye.